Good afternoon, everybody. I'd like to call the Wednesday, October 25th, 2023 Finance, Audit, and Budget Committee to order. First item is Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
Okay, next item is adoption of the agenda. Need a motion to adopt.
The agenda.
Support.
Moved by Commissioner Romano, supported by Commissioner Van Sickle. Seeing no changes, please vote.
Did I say, Adriana, did I say no?
You're good. Motion passes 10-0.
Next item is approval of minutes dated October 24th, 2023. Need a motion to approve.
Motion to approve.
Support.
Made by Commissioner Grott, supported by Commissioner Kraft. Any corrections, commissioners? None, please vote.
Motion passes 10-0.
Item is public participation. This is the first opportunity for public participation for those who would like to speak for a maximum of 3 minutes on an item which is on today's agenda. There will also be a second opportunity for public participation for those who would like to speak on any issue. Would anyone from the public like to speak? Agenda items only. Going once? Twice? We'll close public participation. Next item is proclamations. This is actually a full board approval for proclamation commending Vicki Wolber upon her retirement with Macomb County. I need a motion to grant full board approval at this committee to adopt.
Motion to adopt.
Moved by Commissioner Van Sickle, supported by Commissioner Romano. Chair Brown?
Shouldn't we vote on it and approve it before we hand it out?
Yep, we will. We can call the vote right now.
Gives me great pleasure to present this outgoing resolution to Vicki, who I've known your whole time since you've come in.
Yep.
Were you with the radio department?
Yes.
The old
Yes,
radio department?
radio, yep.
Used to be telegraph department.
It's one of the
No,
oldest county departments.
wasn't that old, but
it's old.
it sure was very good. But you know, you've just been instrumental to us in so many things throughout your career. We had a project, a tough project to go to. You're a person to go to. We'll put Vicki on it. She'll get it. I knew you when you first came with the departments, how well connected you were with all the first responders, all the police and fire departments. Early on in my tenure, the big project that I recall was the radio towers. Putting the radio towers in and having the board to bond for that money to put out the radio towers. Because guess what, back in the day, we didn't have towers everywhere. And guess what, there are places where you couldn't even get radio signals for police and fire in the county, in the south end and in the north end. And through your leadership, you got the buy-in from all those departments to buy in. And what's telling about Vicki, and those you don't know her, she's respected by everyone in the county, north and south, especially in the emergency services circles, because of the leadership and trust you built, the rapport you built with them, trying to help solve problems. Every community's got problems with budgets. How do we get the radios and emergency equipment that we needed? And you found a way to do that and help work with them with the county and with the grants and all the other types of things to get the needs that they need met. The bridge program, you were instrumental in helping get the support of the first responders in the bridge. We had county bridges out across the county at one point. 55 bridges that were out in the county that people couldn't get across because they didn't have the weight restrictions on them, and the board wasn't sure of that. But your relationship with all the emergency responders came in and educate the board on that, and that was something that we used to explain to the commissioners what the issues were. And I'm going to read this, and some of this kind of takes into some of what I've just said, but whereas the Macomb County Board of Commissioners would like to commend Vicki Wolber on her 23 years of dedicated public service to Macomb County. Whereas Vicki Wolber's career began in 1988 with the city of Fraser, she started part-time secretary in the Fraser Public Works Department. She became the emergency management coordinator and then served as deputy clerk. Whereas Vicki Wolber earned an Associate's of General Business degree from Macomb Community College and a bachelor's degree from business administration from Walsh College. And she's certified professional emergency manager with the state of Michigan. Whereas Vicki Wolber joined the Macomb County in 2000 as an assistant director in emergency management and communications. In 2007, she was promoted to director. Vicki Wolber helped launch the Communication and Technology Center, ComTech, which was completed in 2013. In November of 2018, Vicki Wolber was appointed the position of Deputy County Executive by County Executive Mark Hackle and has since held that position. And whereas Vicki Wolber's background, education, experience, and leadership were instrumental and valuable asset to Macomb County during the COVID-19 pandemic. And whereas in 2005, Vicki Wolber was awarded the Mitigation of the Year Award by the Michigan Emergency Management Association. In 2007 was named the Local Coordinator of the Year by the same professional group. In 2014, she was awarded the Professional Emergency Manager of the Year Award by the state of Michigan and by the Michigan State Police Emergency Management and Homeland Security Division. Whereas Vicki Wolber was an adjunct professor at Macomb Community College from 2012 to 2019, she enjoys spending time with her husband and daughter. She enjoys golfing and loves gardening and tending to her plants. A dedicated public servant, Vicki Wolber has taken and tackled many monumental projects for the county. For her hard work and admiration will be sorely missed by many in the county. Now therefore be it proclaimed by the Board of Commissioners, speaking for and behalf of all county residents, by that these presents that the Macomb County Board of Commissioners hereby publicly commends, acknowledges, and expresses sincere appreciation and congratulations to Vicki Wolber on the occasion of her retirement from Macomb County. Be it further proclaimed that a suitable copy of this proclamation be presented to Vicki Wolber in testimony of her high esteem in which she is held by the Board of Commissioners. I want to give you this. Present this to you. You are a real ace of this county. You're going to be big shoes to fill. You've done so many good things. You're such a competent leader that everyone respects. You know, people, when people come before the board and you speak, people trust you. They trust your judgment and your integrity. And you're going to be sorely missed by me and many, all of us here. You know, I don't, anyone else want to say a few words before we let Vicki speak?
We have a list.
Have a list? Mr. Chairman.
Commissioner Romano.
Thank you, Chair. With everybody saying such nice things, I was going to roast you.
I would expect nothing less.
Vicki, honestly, it's been a pleasure to work with you. There were some items that, what's the old adage, we agreed to disagree on it, but I always knew, and I mean this honestly, I could talk to her the next morning and things were status quo. We start from the beginning again. And unfortunately, it's not like that with a lot of directors. So, personally, I really appreciate, you told me a while ago that you were thinking of leaving, and I was trying to figure out how could I get her to stay. I mean, we won 6% pay raise. I thought maybe that would induce her, but apparently it didn't. But honestly, we're going to really miss you. I know you said you wanted to enjoy your daughter a lot more, so I wish you nothing but great things and good things for the years to come. So thank you so much for being my friend and for being who you are.
Thanks.
That's all I have. Thank you.
Commissioner
Thank you, Chair.
Kraft.
Thank you, Mr. Chair. Vicki, incredible asset to this county. You and I, as Commissioner Romano said, we've gone around and around on a few issues as well, but it was more of we kind of had the same goal in mind. We just had different paths on how to get there. And I want to thank you for taking the time to sit and talk to me sometimes for hours about certain projects, especially the central intake project. That's a massive undertaking. And I know you put a lot of time and effort into that specifically. And I want to thank you personally for, helping me we both got to the same place on that one, and all your work during COVID too. I mean, what an incredible time and an incredible job that you and the whole team did, but I know you were a major part of that, and we're really going to miss you here. I'm going to miss you here. So, Vicki, best of luck in retirement, and thank you for everything. Thank you, Mr. Chair.
Commissioner Zinner.
Thank you, Chair. Echoing them, I'm going to say you always appear so calm, and you're always very polite, and you just have it all together. And I realize in this almost 3 years, like everything is going through your mind. You're saving the county, you're saving the world, and here you're just calm as can be. So, everybody else is calm and everybody else does better. And I really appreciate that ability and all that you've done. I've said, I think you're the smartest one in the whole building. And sorry for the others. Stop. She's leaving. But I mean, you just wear it so well. And I just appreciate everything you've done too in your manner about everything. Thank you very much.
Thank you.
Commissioner Perna.
Vicki, I don't know you as well as some of the other commissioners like Mr. Romano. He likes to hear himself talk, but when do you come back as part-time? Do you start next week, Monday, as part-time? November 1st? Honest, that was just a wild guess.
As a contractor to finish up a couple things, yes.
It could take years. Well, thank you for your service. Thank you.
There are a lot of items on this capital improvement fund, so we could keep you here for years, Vicki, but no, best of luck to you. I mean, all of the things that you've done through your career here in Macomb County have been outstanding. I mean, it's just been things that today, if we didn't have, like Comtech is a perfect example, where would we be? So that's kudos to you and all the hard work that you've done over the years. So thank you for your service. And you're always welcome here to work part-time as long as you like. So I think the board has given us enough to keep you here. So at least we got to hear part-time, board. So,
Good job.
Vicki, do you want to say anything?
Sure. Hopefully I can get through it without breaking down. I probably am more nervous now than any other time I've been up here, and that are emotional at least. But it really has been an honor and a joy to serve the public for 35 years between Fraser and the county. And I think it was chosen for me. I'm a believer, so I think that was the path. Luckily, I accepted it at a young age, but I truly love it, and we've been able to do a lot of great things here. We have not always gotten along, and I don't think we are meant to be. I've truly learned over my career, not in the beginning, right? But in my career that really, I think the best outcomes are really through the questions, some of the disagreements, the different ways of thinking, because I think that really gets us to the best answer for the people that we serve and the ones that we work with. And by no means, have I done it myself. There is a great team, a lot of them represented here today. As you know, I made a shift from public safety that was my bread and butter, coming into and even leaving Fraser. I love emergency management and public safety. I switched over more towards the health and community side, as you know. I somewhat asked Mark for that because that's where my heart was going. And that's where I want to go in my personal life, and luckily had the ability to be able to do that. So again, tremendous work. I want to thank everyone for the support. When I've been asked, certain things, especially now leaving, this really is an organization from top to bottom, where yes, at times you have to be told no, but I always felt the freedom to bring new ideas, new ways of thinking, to whether it was my bosses at the time, to this board, and really try to create, some good things, and make things better for everyone in the county. Have a tremendous team here all the way around. One of the things I loved about emergency management is I got to be a jack of all trades. So I learned a lot about every single department in Fraser, in the county, the businesses, the schools. It's one of the things that I think drew me to it and kept me in it, because of the diversity and getting to learn so much and how everything works. And I love government and civics. So, I will say calm. Thank you for that. Many people here behind me can attest to that, especially with COVID, as our last one. Obviously does not always look like that, but again, that's why there are emergencies and disasters. But really, thank you for the proclamation. Thank you for allowing me to serve and be me. My good, bad, and ugly, as it's been, as we've all worked through. But yes, tremendous amount of respect on my side as well. I know you're not in an envious position when you sit up there and the questions you have to make, and they are tough decisions. And I think we've been respectful on both sides, and where we come from our perspectives. But I couldn't be happier. I'm hard to leave, but I'm glad to leave. I'm glad to leave on a high note. I know there's a lot of great projects coming forward, and there's a lot of great people behind me and that are still here and will continue to serve the county well and each other. So thank you.
I don't know how you're leaving with no gray hair, that's what I don't know.
Adriana, I don't know if you called the vote, but I'm sure it was unanimous.
Yes. 12-0.
I voted no.
Okay, next is budget reviews. We have, let's see, four budgets. I believe today all health and community services. So I'll take a motion to receive and file. Moved by Commissioner Kraft, supported by Commissioner Wallace. And the first one is going to be Health and Community Service, which is on page C40 of our budget. And we have our director, Andrew Cox. How are you, Andrew?
Good afternoon, Commissioners. Hope everyone's doing well. We are hoping and intending this not to be that painful for all of the umbrella of Health and Community Services. I'm going to start off with just highlighting some of the work that Health and Community Services does, and then also you'll get a chance to hear from each of the departments. Tremendous job. I don't get a chance to tell them that often, but the folks behind me have been really working tirelessly to provide the services that are so important to some of the most underserved, high-risk individuals that we have in the county. So tremendous work that each one of those departments does, and all the staff that fall in Health and Community Services. In terms of Health and Community Services, it's definitely expanded. A lot of that was directly responsible because of the person that was just up here, Vicki Wolber, significantly invested in Health and Community Services. So we're all the benefit of that and all of the work that she does. So just another thanks to Vicki. And we're very sad to see her go. At least the good thing is I'll get to, I think, still see her on occasion on some projects that will definitely be well received within our department. Health and Community Services, some of the big changes and accomplishments that we had this year was that we were named and stepped up for the lead agency for the Regional Housing Plan. You'll continue to hear us up here and some of the departments as well intertwined with the activities that we do for affordable housing and making that a priority. Each one of the departments that fall underneath me has a role and supports the Regional Housing Partnership plan that we have successfully submitted to MSU and been approved for. So now the real work really starts. You'll hear some of that work today, and then also in the near future, the Edison Crossing project from MCA and Ed Scott under his leadership. You'll be hearing that coming up next month. We're really excited about that, as well as some of the press releases coming out of MSU Extension with the Housing Assistance Program that just came out today. You might not have been able to see that yet, but we are really excited about tackling affordable housing in Macomb, and you're going to see a lot in the near future in 2024 as well in the coming years. Another initiative that's near and dear to Vicki's heart is the MCAT task force. She will remain very active in that group. That is the Human Anti-Trafficking task force that's been established and doing a lot of great work that continues to be supported in my office as well in Health and Community Services, and continues to be a priority that we will work on with multitude of different agencies to tackle that important issue to protect the residents and individuals that visit Macomb County. one of the great wins that we also got was from the Michigan Economic Development Grant, 25 million, that I came up and shared with you a couple months ago, actually, at a meeting. Very excited to get that seed money to start really looking at a comprehensive one-stop shop for health and community services that would include all the departments behind me and that fall underneath me, but also include community mental health and also veterans services as well, to integrate that into a new building, which is much needed at the VERC project. So we'll be looking at those plans relatively soon, but very excited that we were very lucky and fortunate in Macomb to get that grant dollars. So that was a huge win for us this year. We've also been up here several times with renovations just to get us by until we can get that new building at the VERC. If you haven't been by, please stop by. We're happy to have you come visit, but we've been doing a lot of renovations to space, meeting space, just to make it more welcoming for clients as they come into the building. So we continue to make changes with funds available to do that. So I know we have a lot ahead of us this year, but we're very excited about what happened this year and looking forward to streamlining those services that we offer. Right now, we're looking at matrix of services that we currently have in place, but utilizing Qualtrics. You remember a couple of years ago when me and Vicki came up here to you all and talked during COVID about Qualtrics and really utilizing that software. It was expensive, but we promised that we'd be utilizing it, and we continue to do that today. We're looking at utilizing Qualtrics as a way to garner customer satisfaction when clients come through. That could be really across the board as a countywide solution, enterprise solution that we could utilize to put in place. So we're very excited about the expertise we have actually developed in-house at the health department under Krista Willett as the director. Really, that informatics and technology has been key, and they continue to lead and work with IT on that Qualtrics as a cutting edge. So you'll be hearing more about that in 2024 as well. With that, I will present the Health and Community Services budget. It is a relatively small department. We did see an increase in personnel. That is mostly due to the fact that we had an increase, obviously, with the 6% increase in salaries that you'll see there. We also moved a communication specialist position from MFCA under HCS. So the long-term vision is to help support all the departments by having a centralized communications area. One of the things I want to do is get out more in the community and really tell the story about our services, because the problem we have is not quality services, it's people do not know about the services that we have. So we need to find ways that we can better communicate and share those services that we so well do within our departments, but have a consolidated, concise approach to that to help our departments out. I do not need directors writing press releases. I need people that are skilled at doing that to put those together and get those out so they can do the valuable things they need to do within their programs and within their departments. So that will be a initiative that we'll take on in 2024. And that's a big reason why you'll see that difference in the personnel expense line for our expenses. With that, there is not many other changes within our budget, and I'd be happy to answer questions on Health and Community Services budget. Thank you.
Thank you, Andrew. First Commissioner Song.
Thank you, Chair. Hi, Andrew. How are you?
Hi, Commissioner.
Thank you so much for that thorough update. I'm really excited about what you guys are doing and for next year, too. I think last week, Steve had mentioned that the One Macomb fund was moved over to supplies and services. So in particular, I'm looking at C4, page C4. Is that the line item? Maybe Steve would know. And is there a reason why it was moved there?
So yes, Commissioners, that was moved into the supplies and services line in Health and Community Services.
So C4, correct?
Four
Page
zero.
C4? 40, yes.
40,
40.
yes. Yep.
Okay. Is there a reason why it was moved there?
Because that, I would say, because we can use that up to the umbrella of all the departments that fall under Health and Community Services. Vicki, do you want to add a little more context?
Vicki, I thought you were retired.
Better to work already.
Yeah, technically, no, right, Friday. Yes, I was not in the exec's office or that when HNCS was first created, but when Macomb was initiative, actually when Steve Gold was HNCS director, for those of you that remember Steve when he moved up to that position. And it was an initiative under there, and then when the funding started coming through, I believe the funding was made as an appropriation line item. And then when we talked about changes, even last year when I came before the board about where should that program actually sit? Because with opening in HNCS without a director, and then between COVID, there was not a lot that we did under that program. So coming out of COVID, knowing that we wanted to expand the role of HNCS in the community, it was decided, or the thought press, let's also put the money for one Macomb program that had been budgeted by the board for a few years right within the HNCS budget. So it is under the auspices of Andrew now. And I believe that change was made in last year's budget, actually, and we moved it at that time
Okay.
into the supplies and
Got
services
it.
line
All
item.
right, thank you for clarifying.
Yep.
Thank you, Chair.
Mr. Brown?
Thank you. Thank you, Andrew, for coming up. Do we have, with Qualtrics and other systems you have in place in your department, can you tell us how many unique customers you've served over a year?
We can definitely get that for you, Commissioner.
I think
Because
it'd be
it's not
interesting
only,
be interesting for us to know about, because it ties into what you were talking about communicating the services that we have available to people, and if they only knew it, they could maybe take advantage of some of the services, health services available. We do a variety of things at the health department to serve people for a variety of things. And that would be interesting information to know.
absolutely.
And then we could track it, right, and see how it goes, because I would like what I heard, because you're saying what we're hearing over and over again. County does a lot of good things, but we don't do a good job, don't do a good enough job getting the word out to the people, and you've taken steps to try to promote that, and that's a good thing. So we'll have a baseline number to look at now, and as we go forward, we can track and see, if we're making any progress towards those goals.
And so so we can get those numbers of utilization currently of the programs that utilize it. It's both under Health and Community Service, but there are others as well that IT has worked with outside of those departments that utilize Qualtrics now as well. So I could work with IT to get that overall picture of utilization and what we're actually using Qualtrics for and get that to you. I think in terms of tracking programs, not every program is under Qualtrics. So one day we might get there. But we can definitely share the information of what programs are in Qualtrics, utilizing Qualtrics, and what we use it for.
The programs that don't fall under that, do you have the ability to track, unique clients and items like that?
Not always. We do our best to track unique clients, but there's not it's part of the system that we, need to work on. There's not one universal system. That is really the theory in part behind the matrix of services, is that trying to capture more of that within Health and Community Services, of those that come in for one service within one department that could possibly utilize other services in other department, to try to capture that and utilize that. But none of and some of our systems do not allow that cross-talking to each other because of privacy concerns and legal reasons.
Yeah. Okay. We're coming out of COVID, the heavy COVID crisis, and we had systems set up across the county for vaccination centers and so forth to get out, the vaccine to the people that wanted it. Now that we're coming out of it, though, there is a spike of COVID going on right now, but what about using the health department again to get back to the spreading out of health fairs around the county so we can get the vaccinations out to the communities? You've had your hands full the last several years about that, but we're coming out of that now, and maybe can you speak about working with us to try to help push that out to the communities and get out into the senior centers around the county to offer easy access to, because I mean, people in the south of Warren or people up in my neck of the woods, and it is woods, you know, have a hard time sometimes getting down here for that. And if it's close by to them, they have the same needs, they just don't have access, ready access. So it would help us to get out there. Can you speak to that?
Thanks, Commissioner. I think it's definitely one of, you've heard me say from the start that one of my goals and priorities was get out in the community. And I think we've done that. We're not completely there and we won't give up. That'll always be an important goal that we have, to get out in the community, because that's where really the work is done for public health in all my departments. You've hopefully seen more presence from the health department. Krista Willett has done an absolute great job. Some of the commissioners, you know, I very appreciate, have given us really good feedback here at the meetings, and of the support that we've given at different events, whether it be health fairs, bicycle safety, back to school events. And that I think we've really tried to go above and beyond what is even offered. Asked of us to offer, we've gone above and beyond with trying to offer immunizations or health screenings or whatever we can to work with the different communities. We've done partnerships, you know, East Point Baby Shower event, and all the different initiatives that we do within health and the other departments as well. So it's not just health, but it's also MCA,
So it sounds like I'm not
OSS.
aware of the many outreaches you're doing for flu shots and other things out in the county. So maybe that's on me
I think, you know, there's always opportunities, so I never want to say that we're doing enough or all that we can. There's always room for, I think that we try to fit things in. We have a brand new Healthy Communities team that is out there doing community health needs assessment work that is going along very well in capturing partners and working with partners that we've never done before. That is one of the good things I think that came of COVID, is that we were working with people that we've never worked with before. And we really try to continue that momentum. And I think, you know, in my own humble opinion, that I think we've done a good job. And I'm very proud of that.
That's good. Because we do have many ethnic communities around here that, you know, have language barriers, and you've done a good job of getting out to them during the COVID, and hopefully that's carrying through to other things, you know, to other program opportunities for them.
I think it has. You know, we are seeing people come to the table for our community health needs assessment, where we have community engagement. We have partners that we've never had before, sectors that were very missing for representation of different groups and populations. We now have those people at the table, which is a huge success, and I think a testament to the job the health department did during the COVID pandemic, that we earned their trust with being good partners.
You're a big part of our budget, and you're also a big part of what we brag about what you do for our county and for the residents. And all I can say is you got a good staff there, and and keep up the good work. And we'll continue to work with you, and look forward to seeing those demographics to those numbers, and it helps us also, we can understand the breadth and depth of what you're doing. Thank you.
Thank you,
Mr. Chairman.
Commissioner Perno.
Andrew, you're anticipating hiring one more employee for next year, correct?
Vacancies,
Right.
Commissioner? So I have currently 2 vacancies in Health and Community Services. That's the Office Assistant Senior and the Diversity, Equity, Inclusion Director. So I'm anticipating filling those. The OAS was posted, and we're looking at interviewing soon for that position.
2
And-
part-timers?
No, we're filling that at 2 full-time positions.
2 full-time?
Yeah.
Now, you're amended for 2023, and with the 6% increase, there's still a difference of about $190,000. What is,
That is due to that position being moved from Macomb Community Action. That communication specialist position was moved out of Community Action's budget into our Health and Community Services. So that's why you see that difference, along with the increase in the salaries.
how many people involved in that move?
Just one position.
Just one person.
position.
Seems kind of high, doesn't it?
I don't believe so. Once you look at the salary and the fringes and the salary, the personnel expenses, that's what was budgeted.
All right, thank you.
Thanks, Commissioner.
Commissioner Van Sickle.
Thank you, Chair. Andrew, good afternoon.
Good afternoon, Commissioner.
Back a couple years ago, we needed very specialized, very expensive freezers for certain vaccines that needed to be kept at very sub-zero temperatures. Do we still have those kinds of vaccines going through those?
We do. So we still have, as I'm sure you're well aware of, we just recently got the new COVID vaccine, the new boosters that contain the new ingredient from Pfizer and Moderna. We do now have those. We are administering those vaccines, and we're utilizing those freezers for that.
They need that very sub-zero
They
temperature?
do. They still call for that.
Okay, and we still need both of the freezers?
So we have them at separate locations because we offer, that vaccine at the VERC and also at Majestic down in Warren.
Okay, thank you. Thank you, Chair.
There we go. Hey, Andrew, couple questions. Conferences and training for this year, for 2023, was the first time doing this budget, and we allocated 13.5. Are you trending to use that full amount for this year?
For this year. We will not come totally and expend all those funds. Most of the conferences, for a lot of the conferences that we would attend, have already occurred and occur in the springtime when our office really wasn't fully staffed.
Okay. So we should have the surplus there on that line item,
I would
assume.
yes, I would expect that.
Obviously moving the MCA employee to this department, I know there's a lot of changes in employees on HCS, so I'll ask those questions later. In regards to the capital improvement fund, it looks like just one item is under health and community services for this department, specifically the central intake system. And we have budgeted there. It's not for 2024, but it's in 25 and 26, each totaling $4.5 million. What is what will this department be doing for the central intake system specifically?
Qualtrics. Okay. So that is part of that funding for the Qualtrics system to tie in, like I was mentioning, to tie in our matrix of services throughout health and community services for our intake project to link individuals. So the goal is that when someone comes in, some of that information can be either shared, that what they allow to be shared, once agreed upon, that information is pre-populated. So I think this will add to the experience so that when you come in for, let's say, a service for Macomb Community Action and then go to the health department, we already have some of that populated. So you do not have to, in theory, you would not have to fill out all the complete form all over again, which really bogs down the process and creates longer wait times. So it's really would be aimed to decrease and make that more efficient so that you get a better experience as the client.
So to put it in layman's terms, it's kind of like when I register at my doctor and my information's all there.
Absolutely.
I don't have to register every single time I go to my doctor.
That
It's
is
already-
one, yes, that is one of the functionalities that we're looking for.
So when we bought this program, I guess then that's another $9 million expense per the budget, per what's allocated here, anticipated. What was the total amount that we paid for that system initially? I don't remember the exact number when we did this, but I guess why are we spending another $9 million on this?
So when we first bought it, I believe, I want to say, and Steve probably can correct me, or Vicki, I think it was close to $1 million for that program.
Okay.
And really that gave us the starting blocks for the main purpose at that point was to try to create a registry. If you remember, individuals had to call in on Tuesdays. We called it Terrific Tuesdays. It was not terrific, but our phone lines jammed so much that the county system shut down. So that was in direct response to trying offer, but it also on the back end controlled what types of vaccine. It gets very complicated. Our nurses do a phenomenal job of making sure you get the appropriate dose of what you're supposed to get. So that tracks that and makes sure that on the behind the scenes, when you're making that appointment that you're getting the appropriate shot, and that information is also transferred over to our appointment system.
Okay.
So when we are, tremendously under demand and there was a shortage of vaccine, that's why we utilize that system in that capacity. This would be adding on to that for this additional functionality. Now, hopefully, it doesn't cost that much, but I think any type of software technology upgrades, as you know, is very expensive oftentimes. So we want to make sure we have enough funds to do that.
Obviously, this is not something that's being brought to the board right now. Obviously, this is planned for 2025 initially. But in regards to that platform, Commissioner Brown was asking in regards to measurables. I'd like to know what the measurables are as far as what you're utilizing the software for and what we're tracking and what we can do with the software. I know, when we were in COVID, we had to have it due to the necessity. We didn't have a platform, and I know this board supported that 100%. So as we get there, I think there'll be more questions related to that.
Absolutely.
Okay, seeing no other questions on this item, we'll move on to the Health Department budget, which is pages C37, 38, and 39. And then also Special Revenue Fund pages D5, 37, 38, 39, and 40. And also in the Capital Improvement Fund, we have a handful of items there as well. So we'll start with the operating side, and then we'll go to the Capital Improvement side if there's any questions there. Anything that you want to add to these operating budgets specifically, Andrew?
In terms of health community services.
Yeah, so we'll start on page C37.
In terms of health department, a big piece of, you'll see that revenue went up just under $500,000 by $496. In anticipation, a lot of that is due to cremation permits, additional food license revenue increases, and then also Medicaid reimbursements through HMO, and then also federal revenue coming in from vaccines. So that is the reason and the rationale for the increase in that amount for revenue in terms of our operational budgets for health department through the general fund on C37. As you go down to expenditures, most of our expenditures are due in fact to the increase in salaries of our department. It's a large department, and that increase of 1.7 million is due in fact to the increases in that 6% salary increase. You want me to go on to the grant funds, Commissioner, for the health department?
No, we'll just stick with this page right now. If commissioners, does anyone have any questions specifically with this page of the budget? Commissioner Song?
Thank you, Chair. Andrew, what's the increase in supplies and services for 400,000?
A lot of that is due to the cost of buying vaccines now. So we have several new vaccines that we have to purchase. New vaccines, the RSV, there's a new pneumococcal vaccine that we have to purchase, along with now for the first time COVID vaccine that we have to purchase. So that's why that is pretty much all of that is due to the vaccine cost.
Do we get a reimbursement for that so that it would be like net neutral?
So that, some of that is captured in the revenue increases that I mentioned with the federal vaccine program, as well as that is also anticipated with offsetting some of that with billing costs. But that is our best guess for, anticipation of cost of buying that vaccine.
Do you anticipate an increase in administering too? Or will it
Administering
stay the same?
numbers.
Yes.
In terms of the demand, obviously early on in the pandemic, there's quite a bit of demand. I think that demand has honestly waned, back to pre-COVID levels for vaccines. We are trying very hard to get our kids up to date. We see a significant, we're significantly behind still. And so one of the things I've really been a proponent of trying to get the word out to make sure our children are vaccinated. We're almost, last time I checked, we were almost 10% behind where we started prior to the COVID pandemic, with just not even COVID vaccine coverage, but our standard coverage rates for our immunization for our children, for our 19 to 36-month-year-old children. We have to get them vaccinated, and we need every help we can to get that word out, because we will start seeing diseases start popping up that we have already. You start hearing about polio and measles outbreak. That will be coming if we don't get these rates up.
All right, thank you. Thank you, Chair.
Andrew, a couple quick Chair Brown.
Thank you. I see the intergovernmental costs dropped this year. What is that? What do you count? How did that happen? Always good to see.
I think some of that, Commissioner, is a shift from intergovernmental expenditures to the charge for services line. So it kind of just dropped down. So I think that's an artificiality. There's not a specific reason. I think that was just the way that it was budgeted and put together this year.
Are all the accounts from COVID cleared up now? Is your budget pretty much based on, you have any more leftover stuff from COVID that you've got grants funded and hanging over into your budget at all?
No,
Any
there are
money,
still,
any
you'll see on the next page, once we get to it, we are still seeing remnants of COVID funding that are impacting the budget.
And then charges for services, you're projected to go up $770,000, almost $780,000 over the prior year. What's happening there that's causing that increase?
Part of that was taking from the intergovernmental revenue sources and putting it into that charge for services line. In addition, so about 400,000 of that 776,000 increase in that line item for charges of services were what I spoke to early with Medicaid reimbursement for the HMO and cremation permits and federal revenue for vaccines is captured. So that's why that revenue line went up by that much.
Thank you, Mr. Chairman.
Commissioner Perna?
Andrew, on the vaccines that we have in inventory right now, what's the shelf life on that?
Each vaccine, depending on what it is, has a different shelf life.
What happens when they expire? We just dispose of them?
Sure. Yeah. If they're expired vaccine, we have to dispose of them immediately. We can't reuse it due to law.
On the COVID vaccine, how many different choices do we have? Are you signing up for 3 of them?
So right now, I believe we just offer Moderna and Pfizer vaccines. I don't believe at one point we had J&J and some of the others, but right now we just have Pfizer and Moderna.
What's been the spoilage rate on what we've had based on expired?
It's not much. I can get that to you if you'd like to know exactly, but our staff do a tremendous job of ordering, anticipating the need and demand. We also reorder so we don't get ahead of ourselves. So when, we anticipate, what we're going to get, we order a small amount and then reorder. We don't order in bulk just at once. So we have a pretty good system in place of inventory management that our Family Health Services division does. They do it, I don't know how they do it, and keep it straight, of all the different types of vaccines they have, and to keep those straight, and we have very little wastage. I think we're one of the best. At one point, I haven't looked at it in probably a year or so, but we were one of the lowest, I think, in the state, if not the lowest, in terms of local health departments.
So when someone comes in to get a COVID shot, they have a choice in which one they want to get, if it's Pfizer or Moderna?
Absolutely.
So we're never out of one if our inventory.
We try very hard, to always maintain and have the most available choices that our clients are looking for. Like I said, we right now, I don't believe we have any J&J vaccine. Not even sure if it's available to order right now at this point.
All right, thank you.
Andrew, a couple questions. Your current employee count, how many FTEs right now, or how many vacancies do you have in your department in total?
Are you just asking for health and community services or
Just,
health?
just the health department, just this personnel line item related to
Health,
the,
we currently have 8 full-time vacancies and 19 part-time.
8 full-time and 19 part-time?
Yes.
Okay. And then, was that similar to last year as far as the vacancies?
I would say that's, it's less than we did last year. Less vacancies
Less
than
vacancies.
last year compared to last year. So I think we've really done a hard look at those positions and started to fill those. Some of those too are vacancies due to the pause of the system for Workday. We weren't allowed to post, so there was a pause in hiring. So some of that is due to that too. So we'll be looking to post a lot of those positions very shortly. A lot of the part-time, some of that is hearing and vision staff, which is seasonal when we post for those positions as well. So that's why right now it may look like there's 19 part-time, but really that number is far less. When you look at, those will probably be posted relatively soon.
So just kind of looking at the numbers here. So in 2022, you had a surplus of $2.5 million in your budget. And just looking from, the last 3 years, I mean, revenues have gone up a couple million, expenses have gone up 10 million, and obviously a chunk of that is obviously the personnel. But the big one that's probably doubled is the supplies and services. What do you attribute the large increase to, specifically from what you were doing, just a few years ago to now?
Yeah, absolutely. So I think this is artificiality of COVID. We remember a lot of the vaccines we were doing were federal vaccines. There was no cost, so we did not have to purchase those. So a big reason why that is jump, if you look at 2024 and 2021, is the fact that we now have to purchase that vaccine. And that's really, vaccine costs have really driven the supplies and services compared to 2 years ago. And our budget and our actual, so that's an actual budget number on 2021, and this is the budgeted amount that we're recommending to adopt.
Okay. And then last one is your capital outlay. What are you looking to spend the $64,000 on next year?
Some of that is different things like equipment. For example, we have the medical examiner's office, we have cameras for the scene for the investigators to take pictures. Those cameras need to be replaced just because they're old and the technology. So equipment needs and costs throughout the department, that's a big one for the medical examiner's office.
Okay. Commissioner Zinner.
Thank you, Chair. You were talking about personnel, and that's what reminded me of something I needed to ask. Someone had contacted me near the end of COVID when it was real rampant, and she was working and needed to put her child in daycare, and so, but she didn't want to vaccinate her child. Parents didn't want to vaccinate the child, so she went to come and get the waiver, and it took some time to get the appointment. That was during a busy time, and she did it from her phone in the parking lot there, and it all seemed to work out fine. It took 10 minutes. Someone else contacted me recently, and I don't remember exactly when she went to get called for the waiver, but it wasn't near that time at all. It was within the last 6 months, I want to say. I don't remember exactly when. And it took 2 months for her to be able to get an appointment to do what she had to do for the waiver. Now, when these people are setting this up, I know that woman worked, and she was changing daycares because if they change a daycare, or if they, because she was going, I think the other child then was an older child, she needed to have a preschool. Something was a change like that. So every time they change something, they have to have a waiver form, a different waiver form. So I'm wondering, is there, do you have any idea how many waiver form requests you get at this time period versus COVID? And do you need another person in there? I mean, if it took 2 months in a quieter time period for health concerns, it just seems 2 months, do you need another person to help with that? Or what's the status with that?
Thanks, Commissioner, for the question. I think it's a great question and kind of highlights some of the challenges that we have in our school administration program, which is the one that you're referring to that is over the waiver program, specifically the non-waiver program for immunizations. I want to make a few things clear there. COVID vaccines are not tied to mandatory immunization schedule, so that has nothing to do with waivers. You do not need a waiver if you're not vaccinated for COVID. So COVID is totally separate from the school IMS program, which, by the way, COVID is not over. We are still continuing to see numbers, so please be careful out there and take the steps you need to.
I understand.
And we continue to offer the vaccine, so we encourage everyone to get a COVID vaccine as well as those other vaccines. With school immunization program, we absolutely know how many numbers, and we can share that with you. I can tell you that we are seeing record numbers. The last 2 years are the highest numbers that we've seen in probably 13 years of that program's existence since we took it over from the schools. A number of things that we need to educate our public on is that you can get a school waiver for immunization for non-waivers, for non-medical reasons, anytime during the year. You don't have to wait until the busiest time, which is right before school starts, when everybody wants their waivers as well. What we struggle with that program is with the staffing that we have, is that everybody wants their waiver last minute. When if they want to get that waiver, they should really be thinking about that in advance. Of course, I'm going to tell them to think about getting vaccinated, but realize that there's going to be individuals that just disagree and want that non-medical waiver. So we have certain dates that the schools and child care facilities have to get those waivers into us by. And what usually occurs is that those facilities are telling their people to, hey, go out and get this, or get your record of immunizations done and completed. And unfortunately, I think some of those individuals don't listen to that message. So we really need to educate people and let them know, if you are going to pursue that waiver, that you want to do it sooner than later, because you might find a wait. Wait times right now are still long due to the fact that a lot of these individuals are waiting to the last minute to get that appointment. Now, if you want to give me 5 full-time staff members to help that, I'd be happy to take it.
Well, that's my question. This isn't the beginning of school. This woman was, her child needed, she might have, maybe that could have been it. I don't know the exact date, and I can't find out right now. So you're absolutely right on the time period. I understand that. But if you're having that situation now in November, we're almost in November, in October, they should have, parents should have that situation rectified, I would think, when school started in August or the very beginning of September. So if the wait is long, do you have enough staff for it?
I think we have adequate staffing for that program. I think people and individuals need to be responsible and take care of those things well in advance before that time frame. If they want an appointment and they are expecting to get immediately in to get that waiver, they need to do that well in advance so that they aren't dealing with the wait.
So you're saying that you have a 2-month, what's the wait now?
It's not 2 months.
All right, what is the wait now?
So right now, I think we're seeing about 3 weeks for appointments. You know, I just saw the numbers. I think we're booked out solid until the middle of November right now. And I can tell you that we offer appointments Monday through Friday, all day, every day, except holidays, nights, and weekends.
Yeah. What's the latest time you offered during the day?
We go until we close at 5 o'clock. So we go right up until closing time.
So if someone's working, that means they could have to take time off of work also, if they worked a Monday through Friday.
They
9 to
could
3 or
do
something.
that. They could have that option of a waiver, or they could see their pediatrician and get immunized too. So there's multiple options.
Well, if they, apparently, some people don't want to do that. I'm just saying, so there's no coordination of helpfulness with hours, I guess. And at 3 weeks out, well, I'll see if anyone else calls, because it just seems that, you're right, you're certainly right about if they're waiting until the last minute, or if there's a problem in the daycare and they have to get a waiver to go to another one. I mean, and that does happen with children. They say, listen, the child did one thing too many, and you knew that, and they're working. This is our society now. 2 parents are working, so they can't. What do they do with the child? It's hard. This isn't 50 years ago. So 3 weeks out is tough, I think, for these families if they can't get a waiver, fairly easily. 3 weeks out is tough for these families. I mean, that's just the way it is. It
The
should be a
important piece
little more
that needs to,
convenient than that.
excuse me, sorry, I didn't mean to interrupt.
All right, I guess it's the way it is. If
I think it's important that people get educated on these diseases and what they're actually meaning by when they sign off a waiver. One of the things that is very detrimental, that if you have a non-medical waiver, you are not immunized. And if we have an outbreak, let's say chickenpox outbreak in a school, which is, coming back more and more. It used to be where we didn't see any chickenpox cases, but they are coming back more and more now. We have to exclude those children for 21 days from the last time there's symptoms in that school. That is a significant amount of time that children are losing out on education, something that we all agree kids need to be in school, that we learned from COVID. So the parents need to be reminded of that if you sign up for this, you are signing that you acknowledge that you might be excluded if there was an outbreak. So those types of things are so important for our staff that are experts to educate them on. And that's why it does take some time too. It's not just signing a form. There has to be education that we're required to provide as well.
And if anyone ever asks me about it, I say it's a parent, your responsibility. It's your responsibility if you make these decisions. But I know people are thinking, well, people who don't get vaccinated, they don't vaccinate their children. They must be stupid. They must be lazy. Well, I know some very educated people, 40 years and under. They're educated people, and they want to be educated. They're very concerned about things, and they have their rights too. And I'm not saying you're not taking care of them. I'm just saying it's the way it is. Thank you very much, Chair.
Commissioner Wallace.
All right. A different note, I know with immunizations going down like you were speaking of, and education, what are you doing in the health department to educate those that you have seen not bringing their kids in for updated immunizations? Are there any marketing going out to educate the parents that you know of that you could tell us about?
Yeah, thanks, Commissioner. Our immunization program is doing a lot to advertise. One of the things that we're also looking at working on is a mobile immunization van. We realize that we have to get out in the community. We can't always expect people to come back. And that's challenging because you want a clinic environment that's suitable for those type of procedures. So I can't just go on the street, on the sidewalk and immunize you because that's not good practice. But if we had a mobile vaccination unit that we had and that we're working towards right now, looking at that, I think we can utilize some grant funds for that. That is one solution that we can get out and actually work with the communities and make it more convenient and accessible. I think there's a huge need for accessibility for private practitioners to offer that. That's another piece of this. It's not just the health department doing this. It's our Vaccine for Children program that are pediatricians that are providing that vaccine, how important it is to have that conversation and really be an advocate of that for the parents to have that discussion. I think we got away from some of that because of COVID, and some of those practices were closed, obviously as well. So when we're getting back to those appointments, engaging in those conversations, so our program and our nurses have done a tremendous job of trying to educate those providers on that to get that in. Myself and Krista and the rest of the team at the health department have been on radio interviews, NPR, talking about the need and what happens if we aren't, if we don't have vaccination coverage rates and the importance of it, and why it's not just an individual look, it's also to protect the people around us and that message as well. So we continue to try to get that out there. But if you have any ideas or suggestions, be happy to work with you on that.
I will definitely reach out to you. I never hesitate to email you. I think that that's a great idea. I've noticed speaking to a few superintendents around, there has been a increase in homeless youth, where, of course, with the parents, their first thought is not to, keep up with the immunizations. But if there is easier access, that would be great, and easier for us to, speak on your behalf as well. I said before, your team came to our back to school bash. It was received great. You guys were awesome. So for any of the commissioners, if you see anything going on in your community, just reach out to Andrew if you think it would be a good fit to have his team there. I think it would be great to just let the community know that they are there and easy to access.
Thank you, Commissioner.
Thank you.
Commissioner Grout.
Going back to the vaccines, if you can tell me about, I am on page D40, COVID workforce development. I know it was in the budget for this year, is predicted for next year, 345,000.
Commissioner, can you speak into your mic? We can't hear you over here.
I think he can hear. D40, the COVID workforce development.
C40 for Health and Community
No,
Services?
D40,
D40.
D40.
Commissioner, we're going to do the special revenue funds next. We're just on C
Did I jump ahead
37,
of-
38, and 39 right now. I'm jumping ahead. I know you're anxious to get to that special revenue, as I am, but we're trying to stick with these 3 pages right now.
Then I can skip it one to wait till you guys ready.
Any other questions on these 3 pages? I've got just 2 more really quick, Andrew. So medical examiner, we've increased that by 3 FTEs. Are we just changing the structure there? I know obviously, I think we had them all managers and supervisors before. Or are we just putting them all in the medical examiner?
So we
line item?
eliminated 3 existing positions and turned those into those medical examiner positions. So the deputy health officer, as well as 2 existing manager positions within the medical examiner's office, public health service managers, were created those deputy medical examiner and the medical examiner position.
Okay, and one last question. In regards to charges for services and your supplies and services, I know you got an increase in revenue for the charges of services. Obviously, we've got an increase in the supplies and services because you said that the vaccine costs have increased, and obviously those were given to us previously from the federal government, although we do have federal revenue coming in on the charges for services. So I think Commissioner Perna was kind of referring to this as far as like the shelf life for the vaccines that we're purchasing. Do we have some type of a system or an asset management that we're tracking these vaccines so that we're not overspending? Because based on kind of these numbers, there's about $500,000 there between the 2. And obviously we don't want to just buy vaccines and throw them away. So what is the plan with the increased cost?
So the plan is, in terms of inventory management, to continue to trust in your really professional, well-educated, and capacity health department that has done a tremendous job of not wasting vaccines and doing a good job of managing that inventory. And that will continue on. So the same folks that were there during the pandemic are there today.
Okay.
And so they have extreme amounts of knowledge on how to demand, manage that inventory. They have their own system in place to manage that inventory and do a tremendous job doing that. So I have no question about trusting them to continue the great job they're doing and have done.
And does the call track system assist them in making someone aware that they're up for a vaccine and kind of like, I want to say forecasting what they do need to order for the future?
Yeah, so they are directly looking at call tracks and appointments coming in and what they have. That directly affects what they're going to be ordering, so they can see what's coming in, what appointments we have, what do we have on hand, do we have enough on hand to meet the demand. Obviously, we also have walk-ins, but we do a pretty good job of figuring that walk-in demand of typically what we see every day with walk-in clinics. And so we can estimate, that our inventory will meet, or if we need to order additional vaccines. So that's how they use call tracks.
Great. Okay, moving on. So no other questions for pages C37 through C39. We'll move on to the special revenue fund pages. D5. We'll start there, and then 37, 38, 39. Might be able to just. Let's just start with D5.
Okay, thanks.
Anything that you want to add to this budget specifically? And we'll take questions if there are any.
I don't have any specific.
Okay, good play. Commissioners, any questions? Commissioner Kraft.
Thank you, Mr. Chair. Just a quick comment. I am excited to see the increase in the inland beach monitoring and the qPCR sampling. So thank you, Andrew. Keep up the good work. Thank you, Mr. Chair.
Thanks, Commissioner, for your support.
Commissioner Brown.
Commissioner Kraft took my comment. What is the, but also a PCR, what sampling is that specifically?
So that's in line with our beach sampling. So we used to do a system called, we still do. We have Coley Alert, which is the system that takes us 24 hours to get the results back. But the PCR is what we've known from COVID is the polymerase chain reaction system that can take the DNA, replicate it, and get a result between 2 to 4 hours typically. So it's not real time, but it's a lot less of time to get results. And that's what we currently utilize, that PCR. That we have changed to an advisory system for the beaches now. We used to be stuck with a 30-day, which really killed us at our beaches. Yeah. And it didn't make sense because our water, because of Lake St. Clair and the movement of water so quickly, you would have a high hit, but then it would, 24 or 48 hours, it'd be completely different water quality conditions. So I think we've done a lot of work with advisories now that allow the beach to stay open and make sure that it is indeed safe, because things change so rapidly. And that's not the case everywhere else in the state.
Yeah, we've come a long ways with your crap hills from real-time monitoring when the days we had no monitoring at all, except.
Yes, we have.
Also, another question was on the breast and cervical cancer screening. It's down by about $10,000 coming year from this year. Did we lose a grant?
That program is not existent, so it's just spending out that program, that grant, those grant funds.
Thank you, Mr. Chairman.
Okay, seeing no other questions on D5, we'll move on to page D37, 38, and 39 and 40.
So I got the question, commissioners, about what is there still remnants of COVID within our budgets? And I think absolutely there. You saw with the other general fund dollars that transition is getting back to normal, but you can still see the difference between additional expenses that we've had to take on, because a lot of that was being charged during COVID to our grant programs. In this, you'll see grant funding start to be reduced. A lot of that is tied directly to intergovernmental changes and reductions in the revenue there that are forecasted. also increase, a slight increase in some of the other charge for services, but the big one was the reduction in governmental, and that's directly related to the COVID vaccines, or excuse me, COVID grant programs that are being reduced. We still have several grants attributed to COVID, contact tracing, COVID workforce development that Commissioner Grott would like to ask about, and IMS, COVID immunization grant as well, that we continue to see. Be happy to answer any questions on the grants.
Commissioner Grott, do you want to?
The page number 40, there was the last about the COVID, and another one is nurse family partnership. Can you explain a little bit? I'm new, I
Absolutely.
would like to know.
So I'll start with Nurse Family Partnership, that grant.
Okay.
That is a program that is a field nursing program that goes out to first-time mothers. Recently, we expanded the Nurse Family Partnership program to also include MyHIP, which would include additional children after the first child. Oftentimes, we assume that I think once you got it as a mother or a family member for your first child, we don't account for the changes in the second and third and fourth children and so on. So sometimes our families, our mothers absolutely need additional support. So we wanted to expand that. In the NFP grant as well, there is an additional component that wraps into our Safe and Healthy Macomb initiative. When we talk about wraparound services, this is one of the initiatives that we've done is increase training. We have additional staff in our Nurse Family Partnership program for substance abuse specifically. So if we see evidence or have conversation when we're doing our field visits that person might benefit from that field nurse out there, they now have the training capacity to work with them to refer them services or educate them on substance abuse for our families. And also that ties in very nicely to what we're doing overall in the county with the opioid settlement dollars and the Safe and Healthy Macomb project. That fits right into that initiative as well. COVID, I think you're asking also about COVID workforce development.
Yes.
That is a specific grant that was given from the state that it has to include COVID, but we are intending to utilize it for our strategic planning, our community health needs assessment, and our community health improvement plans. Because we get creative, we include COVID in that work, and we can utilize some of those funds, and that's what the intention of those grant dollars to help us support individuals that'll help us facilitate those meetings and putting together the documentation there.
Going back to the Nurse Family Partnership program that you have, do you have a number of how many families in Macomb County you guys serving?
I do. I don't have that offhand. I can get that to you.
I'm kind of curious.
Absolutely.
Thank you. Thank you, Mr. Chair.
Andrew, can you talk a little bit about the supplies and services line? It's going up $2.5 million.
So as you put together budgets, working with finance and our counterparts there, sometimes we're left with trying to budget and put dollars, and we don't always want to put them in personnel expenses. So those were placed, a lot of that was COVID grant dollars that was put in supplies and services, specifically the contact tracing, COVID contact tracing grant. So it more or less is a placeholder. We don't intend to use $3 million in supplies and services.
So theoretically, we don't really need to transfer that large of an amount from the general fund into this budget based on what the needs are of it.
Well, we have to account for the grant is specific to what you can utilize it for. Okay. So if you don't give me as much general fund dollars, I do not have the ability to necessarily do the things I need to do. Unfortunately, with COVID contact tracing dollars, that is very specific on what is allowed and what's not. And so that's why the challenge for us is to really try to utilize it and be creative as possible, but sometimes there's no flexibility from the state from us for us to do the things we need to do.
But I mean, in regards to that, I mean, we're not going to be spending $2 million on tracking this. I mean, that's what I'm kind of trying to get at here is that I understand it's a placeholder, but it's a placeholder that is requiring us to transfer dollars out of the general fund into this budget for something that may not even happen or most likely will not even happen to that extent. Because I mean, I can't, your budget has never, that line item was 400,000 a few years ago, and it's going to be 400,000 next year and the year after that. But this year it's $3.2 million. It's just huge.
It is.
So, okay. And then the only other question I did have was the $2.5 million, if it's specifically related to.
Commissioner, I think, sorry.
Oh, Steve, he's
Point
been
of
down the mic
clarification,
today.
I think. So I think you're going along the lines that the general fund contribution includes the $3.1 million for the contact tracing grant or program?
I'm just looking at what your transfer in is $4.4 million of that total budget.
Right, and none of that none of that 4.5 million pertains to that contact tracing program. That's all grant money. So the general fund contribution is funding things like the nurse family partnership and
We don't have to go through the entire list right now, Steve.
Right.
Why don't you just follow up with us because
right.
that just stands out specifically. And I just don't understand how it works.
Okay, all right, so what I'm trying to say is, if we reduce the supplies and services line item, we're not relative to the contact tracing grant, we're not correspondingly reducing the general fund contribution, we would be reducing intergovernmental revenue.
Gotcha. Okay. So intergovernmental revenue and supplies and services are intertwined, correct? So then let's just use that as the example. Last year you had more revenue in that line item and less of an expense. So if they're intertwined, how are they intertwined? I'm all about numbers.
So for 2024, you'll see a large increase in supplies and services. You're seeing there's a decrease in intergovernmental revenue. So it's gone up because of the contact tracing. There's some other things that have probably gone down. And what I'll say to you is we'll touch base with Andrew's team and kind of
It's just a
reconcile
big
that
number. I
change.
meing, when I see $2 million,
Right. I know
it just,
I know what
there's
you're
a
saying.
huge difference.
Right.
So, okay, Commissioner Kraft.
Thank you, Mr. Chair. Andrew, real quick, on page D40, the NFP substance use disorder for about $500,000. Can you quickly explain what that is and why it falls under the health department and not CMH/Office of SUD?
Yeah, so specifically the NFP program is an evidence-based program that has to be funded to a local health department. So that those dollars have to go to the local health department. They don't, they cannot go to a CMH or any other agency. So it's very specific that you have to get certified for. So we have to send staff out to get trained specifically on NFP, which is a national program.
Okay. That's kind of what I figured. Just wanted to make sure. Thank you, Andrew. Thank you, Mr. Chair.
Commissioner.
Thank you, Chair. I'll just be brief. I did check on that situation I was talking to you about. The date for that mother to get her waiver, her appointment is December 6th. And it was probably the beginning of October and maybe earlier. So that's 2 months. Would you have considered the beginning of October a busy time?
Extremely busy. So,
School starting the beginning of August?
yeah, so with the school immunization program that facilitates that, they start picking up in August, even
Okay.
July, they start
All right.
doing.
So if that's a busy time, I'm thinking of when I had my kids for things that I'm thinking you should probably have, thinking as a regular mother with dealing with things, that you should have another person to get people through this time. Pull them from another department. I realize that this is a very intricate area. I remember people calling. I understand that area is very intricate. I've spoken with the nurse years ago on that kind of stuff. I actually met her, and she explained what it was, what she had, her phone calls. So I realize that's a very technical area. So the situation is, these people can't put these children in, they're working. So that's a problem for our Macomb County citizens. Is there any way that you have someone that can be trained to do this if they need to?
The issue is I don't have staff that are just sitting around with capacity that aren't doing anything. So if we reallocate and refocus, that means another program's not being tended to. So there's going to be unintended consequences of taking that staff member and putting that program in that program specifically. Fall's a busy time for us, not only in SIP, but EMS. You have to have a nurse that can do that education, and fall is, as you know, is probably one of the most busiest times, if not the busiest time, for flu shots, and our seniors and others that are
Yep.
really coming out to
I
do those
understand.
clinics. So if I take a nurse from those other areas, now we can't do flu shots.
I understand. So are there other times of the year that are also busy for
No.
something like that?
Nope, so
Only the
right after, usually December, after December, it
It winds
fluctuates and definitely reduces the number of waivers that we're doing.
All right, thank you very much, sir. Thank you, Chair.
Commissioner Lucido.
Thank you, Chair. So on D37, I noticed there's a big decrease in personnel coming from 2023 to 2024, but your staffing levels aren't really changing.
It's a shift in the COVID grants that we are charging. So we are charging a lot of our general fund dollars, and our staff, our staff that we have, we are charging them to the grants. As the grants have reduced, we have actually moved that back to their cost centers, and there's less personnel expenditures coming out of the grants because simply the COVID work is reduced. So it really represents a starting to return back to normal, so to speak, for our budgets and health department.
Okay. That's all I have, Chair. Thank you.
Okay, seeing no other questions for the special revenue pages. Andrew, there's just a few capital improvement items. Commissioners, are there any questions specifically to these items? One, I'll just read them off quickly. Morgue imaging, food inspection equipment, integrated system, septic phase 3, and the electronic health medical records system. Can you just talk about the medical record system? That's the only question I had.
Yeah, thanks for asking, because I did unfortunately leave that out, but I think something that is really going to be huge for us, in the coming years, that we're looking at replacing our outdated electronic health records. So if you go to any type of physician or medical practice, your information is most likely entered into an electronic health record of some kind. We are looking at working with IT on looking at different systems, and we're hoping to upgrade our electronic health record system to do all the functionality that we need it to. We've put a lot of money over the years into our old system, but it gets to the point where you can only add so much to it before it just doesn't work. It's almost like adding rooms to a home. At some point, it just doesn't work and doesn't work well. So we're looking at replacing that with a brand new system. So we're really excited about that investment.
Seeing no other questions, Andrew, I think you're done. We're moving on now to Macomb Community Action. Is Ed here? Is he here? And Commissioners, this is pages D30 through D34. How are you, Ed?
Hello, everyone. Good afternoon.
Ed, I don't know if you have any items on the capital improvement. I don't think so, but I don't believe so. But just those budget pages, commissioners.
Okay. So good afternoon, everyone. Edward Scott, and I am relatively new in this position. I came on board here in June. Prior to that, you've seen me speaking on behalf of MSU Extension. So very happy to have made the transition, and here I am. I do want to spend just a few minutes providing some highlights from the past year from some of the programming that we provide at Macomb Community Action. Through our action centers, which provide things along the lines of rental assistance, utilities assistance, we served approximately 6,000 households in the last year. Our transportation services, along with our housing rehab and weatherization programs, have reached over 4,000 households over the past year. We have worked with over 2,000 children through our Head Start and Early Head Start programs. Our food program has provided 2.5 million pounds of food to over 250,000 households, and that's really working primarily through our network of 70 pantries throughout the county. I do want to just take a moment to say thank you to this board, especially for that. I know there was some additional support for the purchase of food that came through last year. We're very grateful and thankful for that because the need is still there. I understand that in an earlier meeting, our colleagues from the Treasurer's Office discussed some funding around financial empowerment centers, and so I did want to provide a little bit of context and information around that. We've been working on an initiative. This started before I came on board, actually, but we've been working on an initiative to try and establish a financial empowerment center. There's an organization called Cities for Financial Empowerment that offers grant funding to help start up and in some cases maintain financial empowerment centers whereby organizations, particularly local government organizations, can provide financial literacy coaching, learning opportunities around budgeting, how to understand ways to utilize credit, how to understand ways to avoid poor financial decisions and poor credit decisions. And so we're at the point in that project where we are ready to stand it up, and we are ready to look at what a staffing model looks like. We have 3 positions that you'll see that we're asking for a budget of approximately $250,000. I think the exact number might be $259 now that we've factored in the 6% increases for salaries. The Treasurer's Office has agreed to cover half of that. And the other half will come through grant funding through the Cities for Financial Empowerment organization. And we're also looking at a small portion of that, approximately $30,000, that would be covered by general fund. Our understanding is that because of existing ordinance, the Treasurer's Office cannot simply give us those funds, but they have to contribute them into the general fund and then through the general fund to us. And so that's the reason why it's routing that way. So we're looking at, the potential for kind of coming into phase 2 in 2024. I will, just share, again, I started in June, so there's a lot that I'm still learning and wrapping my head around, but I'll do my best to answer any questions that you might have.
Commissioner Song.
Thank you, Chair. Hi, Ed. How are you?
Good, how are you?
It's good to see you. First budget hearing for you.
Yes.
Regarding the Macomb food program, and we all know there was a need for that last year, and the board generously agreed to appropriate $300,000. Do you know this year, it's kind of hard the way the budget is set up, how much is actually going to be going towards that in 2024?
So as it's currently established, we're looking at $500,000 as our request for food.
Okay.
I will be honest with you, we could use more, but we have to be good stewards of the resources that are available. But $500,000 is what we're looking for, specifically dedicated to the purchase of food.
Is that, and this is maybe a Steve question, is that it on D33? And I know I asked this question last year because we've got community program / emergency food and then Macomb food program, 2 separate funds.
Bear with me while I try to find.
D33, it's
Yeah.
more towards the bottom.
I actually think I can.
So
speak
it's,
to that.
go ahead, Ed.
So the emergency.
Can you speak in the microphone, please?
The emergency food program are the dollars that we receive from the federal government, TFAP. I don't remember what that stands for.
got
But
it.
that is our commodities. And then the other pot that you mentioned, the food program, is where I believe that 500,000 would be.
The 500,000 is in, or included in the 3.7 million.
So what's the rest of the 3.7 then?
It's the purchase of food and facilities, and I may need to get back with you on more
Okay.
specifics, but
All
I'm
right,
happy
sounds
to
good, but
follow up.
specifically just for the purchase of food, you guys have appropriated $500,000.
Yeah, the dollars that were appropriated last year and that we're asking for this year, that is specifically for the purchase of food. You know, we do have records going back through last year of receipts of the purchase that totals that.
Okay, and then my next question is, on the Macomb County website, under MCA, I noticed you guys rebranded, so now it's Community Food Bank. There's a donation button there, so where does that money go?
So that money goes directly to the purchase of food. There is some work underway to set that up so that other programs within community action can receive donations as well. But in its current iteration, correct me if I'm wrong, in its current iteration, any dollars that come in to that donate button come into the county's coffers and then are used directly for the purchase of food.
So Steve, that money that is donated to the county or MCA, would that fall under other revenues? Or like, is there any significant, I guess, activity there that you would anticipate there could be an increase?
Yeah, typically, any kind of donation revenue would be classified under other.
Other revenue?
Yeah, other revenue.
So D30?
D30, yes.
Okay. I mean, I think a lot of people feel very strongly about food insecurity, and I love the fact that you guys have put that donation button up there to allow people to contribute. I'd really like for you guys to possibly promote that and to really push for outside donations. And it doesn't look like that's the intention here, because if it would fall under other revenue, 2024 is a decrease from this year, and the forecasted as well too.
So there are a lot of internal conversations going on around our funding just in general and ways that we can enhance the dollars that we get from the government programs as well as our county general fund allocation. One of those options that we are discussing is how do we best promote the donate button? How do we, do we consider seasonal drives or campaigns? Once we have those ideas a little bit more crystallized, I think there'll be a lot of opportunities to engage this board, Mr. Hackle, other community partners in assisting with us. But those talks are happening.
All right, thank you so much. And this
Thank
is
you.
nothing, towards you at all, but I think the board needs to know that, that this donation button is there, and that if there are any funds that do come in, that we need to keep an eye on that. In the past, that donation has gone towards the Macomb Food Program nonprofit 501c3, and now it is going towards the county. So wherever that money is going towards, I just want to make sure that it is going to the people that need it the most. I'm an advocate for food security, and so I feel very strongly about this. And, I want to be an ally, and I want to make sure that as we are looking at this budget, yes, we are going to be asked from different departments for money, but that, we make sure that we take care of our families as well, too. So thank you. Thank you, Chair.
Thank you very much.
Commissioner Wallace.
Thank you, Chair. First, I want to say that I'm very excited about the Edison crossing. We got that information. So very happy about that. It looks great, and just excited for those that will be able to move in and live there. Secondly, I wanted to talk about Head Start. I know with the change in location with King School being closed this school year, you had to move elsewhere. I've heard that there has been a drop in the number of students. I don't know how accurate or how big of a drop that's been. Can you talk about that and what's going on and what you are doing to promote it and see that increase? We did have last week, someone was at King Live just complaining about the school district, but parents drove up asking with kids in the car, thinking they could go register their kids. They had no idea where Head Start was. So that was not the best look on someone's live while they had what they were doing. But if you can give us an update on that.
Sure. So we did move out of the Washington Elementary property, also known as the Family Resource Center. That relationship just was not going to continue to work for us, and the maintenance of the building was poor as well. And so for the foreseeable future, that does mean a reduction in the amount of classroom spaces that we have available to host Head Start. We are constantly in discussions with school districts and other community partners to try to find additional space for right now in the near future. One of the projects that's on the horizon, though, is the county has purchased an elementary school building in Mount Clemens, formerly known as the Faith Christian Academy, and that is a purchase, so it is a county facility. So the maintenance of that facility will be up to par. We won't be having to worry about leaks and infestations and things of that nature. So to my knowledge, we closed on that property a little over a month ago, and we'll be beginning the construction process. Construction process is going to take a while, probably through the rest of our current school year. I would say best case scenario right now, we would be looking at June to July for occupancy to be able to open up Head Start rooms. And so that's kind of where that stands. I think the other piece of the answer to your question is I would go back to something that Andrew talked about, and that's with our own marketing and our own ability to just get out and be in community. So again, I'm relatively new to this position. We did a lot of work finding opportunities to get out and be in community when I was working for MSU, and I anticipate doing that, here in this position as well. I think, Commissioner, you should feel free to reach out to me anytime to say there is an event happening here. We would love to hear more about Head Start or your food programs or any of our other programs that we have to offer. And I'll do my best to make sure that we either have someone there or that I'm there myself.
All right, I will add you to my list. So where are you located now for Head Start, and what are your numbers looking at like right now for this year?
So I don't have that readily available, but I can get that to you.
Okay.
Specific numbers. Do you
Yes.
know a specific number? Okay, take it away. I stand corrected. I do have that right.
So we are technically fully enrolled at this point. The only thing we're waiting for is some licensing of classrooms. Therefore, we did relocate all of the children from the Family Resource Center to other classrooms throughout Macomb County. John Paul Rea did a shout out to the districts when we were foreseeing moving out of the district, moving out of the site, and we were able to get a lot of the superintendents to provide additional classrooms for us. So at this point, licensing is backed up because the licensing consultant has to come in and actually ensure that the classroom's ready to go live, but the children are there. So we are not under enrolled at this time.
So the number of enrollment compared to last year is similar?
We reduced the number of enrollment slots because
Right.
we were able to do what's called a change in scope. So what we found and what the feds basically reached out and said is, we want to continue to fund you at your full amount, but because of mental health and challenges in the classroom, you're allowed to keep the money, but reduce your amount of enrollment slots because the teachers were taxed, the children's behaviors were through the roof, the mental health supports weren't there. So we're at full enrollment, but we just reduced the number of children we're providing services to provide the most quality services to those families.
Right. Can I get those numbers of enrolled this year compared to last year?
So
Thank you.
1,022 versus, I think it's there's 846 Head Start. Yeah, we'll get through the exact
Thank
numbers,
you.
but the original ones were 1,022 and it's
Okay.
gone down. Yes, thank you.
Chair.
Commissioner Brown.
Thank you. The partnership that's starting now between your program and the treasurer's office, where did that originate at?
It originated with our own staff pursuing that initiative. As I mentioned, there's an organization called Cities for Financial Empowerment.
What was that again?
Cities for Financial Empowerment. Financial literacy is a complementary service to many of the programs that we offer. And Community Action has worked in partnership with MSU Extension, actually, around financial literacy and financial empowerment for a long time, a number of years. And so this is an opportunity to actually, bring staff into the picture and really increase our capacity to work with individuals who need help learning how to manage their finances and to make
It's a
good
good program.
decisions. Yeah.
Why didn't you just go to MSU Extension rather than the treasurer's office to do that? No,
Well-
could you do MSU didn't have the capacity to expand?
MSU Extension has
They're
the
tight.
knowledge resources, but the treasurer's office had the delinquent tax fund to support it.
Okay. On D30, again, charges for services are up, and the intergovernmental is down. Steve, is that the same thing going on that happened in the other department? Right?
Yeah, you'll see a steady decrease in the
The charges for
intergovernmental.
service are going up, and then the intergovernmental is going down substantially from 73,000. Well, what's going down?
Yeah, so I see charges for services going down
Yeah,
and intergovernmental going down as well. So some of the intergovernmental
but that means
decrease.
$5 million less in charges for services. What's that about?
I'll get back with you on that. I think there may be a classification on in-kind revenues going on there. And through also in intergovernmental, you'll know that still over the last 3 years, a lot of the SARA money, rental assistance money that came in earlier years has been spent down. So there's going to be a decrease there as well. But I believe there's a classification difference between 23 and 24.
If you could just
on
send a
in-kind
note to
revenues.
Kyle or something
Yep,
like that, so
certainly
I can
will.
know, unless the rest of the board mention, but I'm curious about that. Also, and then contract services are substantially down going into the next year. What's accounts for that? What's happening there?
So these reductions are primarily tied to the SARA funding no longer being available, as well as Head Start American Rescue Plan funds. So what you're seeing there in these reductions is really kind of a return to our normal. levels
Okay.
of funding from pre-pandemic.
And repairs and maintenance is up quite a bit too. What's, is that, what do you count, what are you looking for that? You Anticipating more repairs and maintenance?
Yeah,
Is
so
that the
as-
other building you're bringing on?
It is. As we were kind of talking through this process this year and knowing that the purchase of the building was happening and that there would be construction and some retrofitting and lead and asbestos abatement taking place, we did build in funds to anticipate, movers, anything else.
I
that may be
understand.
necessary.
Okay. Thank you, Mr. Chairman. Thank you for coming out. Good to see you.
Thank you. Good to see you
care.
too.
Commissioner
You
Van
got a
Sickle.
lot on your plate. I appreciate that. Let's keep balanced.
Appreciate
Thank
it.
you.
Commissioner Van Sickle.
Oh, I'm sorry, I didn't hear you. Good afternoon. Homeless prevention, I assume that's to prevent people from becoming homeless, so you're helping people stay in their homes?
Yes.
How does that mesh with the treasurer's program to get people on payment plans and things? Is this a different?
So I assume you're referring to people who might be facing eviction due to back taxes?
Yes.
So those two things don't necessarily enmesh, but there is an opportunity through both the Financial Empowerment Center, but also simply referring people to our services. We provide resources for people who are behind on their rent, if necessary, in order to prevent homelessness. And in some cases, we're able to provide resources to help people come up with first and last month's rent and security deposit in order to help rapidly rehouse them if they're losing their home. And so we do have some federal funds that are available to do that, but the piece where I think that it ties in with the treasurer, and we've seen this model at play in other theaters, here in the county, is that when someone comes to us and they have a need, they haven't been able to pay this utility bill or this rent, or haven't been able to make ends meet in terms of food. One of the greatest tools to overcoming those obstacles is knowledge and learning. So we understand the real problem is that there's no money, but how do you work as best you can with what you have? How do you make sure you know enough to avoid going to that payday lender that's going to charge 700% interest, right? Or to take out that payday loan. So we are hoping, that this Financial Empowerment Center will really stand out as a complementary service to the programs that we already offer.
When you supply people's security deposit and they move out and get that back, does that get returned to you?
I'm not familiar enough with the program to answer that question.
Good afternoon, Commissioners. There's a lot of different programs that do that. The one that Ed was referring to with the Treasurer's Office, typically those would be homeowners. Most of our homeless rapid rehousing and homeless prevention would be for people who typically are renters. When we do have instances where we are providing things like that, we will work out an agreement with the landlord where if a security deposit is given back, it's given back to the county and not to the person.
Right answer. Thank you.
You're welcome.
Thank you, Chair.
Commissioner Romano.
Thank you, Chair. Good afternoon. I want to get back to this foreclosure thing with working with the Treasurer's Office on foreclosures. Have you ever contacted the Treasurer's Office on these foreclosures? On a possible foreclosure, I come to you, I'm 2 or 3 payments behind. What do? Have you ever contacted the Treasurer's Office to see if payments could be worked out?
To my knowledge, Macomb Community Action has not. I can tell you that MSU Extension does do that with their financial coaching. Again, is that something we engage in typically?
Joe, do you understand my question? I mean,
Yes, sir.
It seems like there should be a partnership in here somewhere along the line.
Typically, we don't get funding to help assist with property taxes. We can assist with mortgage payments and that type of things. So if we're working with the Treasurer's Office, it's probably because somebody has come to us with a tax problem. We refer them to the Treasurer's Office to try and work out an agreement. We don't have funding per se to pay for back taxes, but we can help with mortgage payments. So we would work with bank and financial institutions.
So is that funding specifically earmarked strictly for mortgage payments?
Rent and mortgage, yes.
It says that in there, that is strictly for,
Absolutely. We're not allowed to help with property taxes.
Answered my question. Thank you, Chair.
You're welcome.
Commissioner Grout?
Thank you. Hello. I got a question, page D33.
Commissioner, we can't hear you.
Microphone, please.
Sorry. SSVF veterans, can you please explain and why the amount it's much lower than last year? That's for some kind of services for veterans.
SSVF veterans is what you
Yes.
said?
340.
I believe that is tied, you know what, I'm not gonna guess. I'd like to get you the actual answer
Okay.
and follow up with you. I believe that's tied to our transportation program and a reduction in funding, but I want to make sure that's the accurate answer.
Another question, I have citizens that need assistance, maybe helping somehow financially, like with the roof or driveway. Does the county provides any assistance like that?
We do.
For veterans, I'm not sure 100% if he is veteran, but
So we do provide that service. It is income-based, so there's an application in order to meet the guidelines of our federal funders. But if they fall within the income guidelines, that is services that we provide. We do all kinds of housing rehab projects. I've seen driveways done, roofs, new windows, weatherization, all of that.
I will give you a call.
Please do.
Next.
You have
next
my
time.
card now.
Yes, I do. Thank you so much. Thank you. Thank you, Mr. Chair.
Edward, I know this is, obviously this is the first time doing this budget for you, but you have done the MSU one in the past. I know, I'm still trying to get my head around the financial empowerment plan here. And the reason I ask that is because MSU Extension has been doing this plan for quite some time. Matter of fact, it's in the brochure, and I know they're up here next in our budget, but last year they helped 531 residents in a financial homeownership educational program, in conjunction with the treasurer, of which 121 residents were facing foreclosure, received free financial coaching and budgeting education. What I'm trying to understand is we fund MSU Extension 100% out of the general fund, which we have for years. And I know this board has actually talked about not doing that in the past. What I'm trying to get my head around here is that now we're looking at Macomb Community Action and partnering with the treasurer and having a subset of this when we're already doing it at MSU. And maybe this is a question more specifically to MSU, which is going to be up next. But I just feel like we're doing things twice here, and Vicki's there to maybe talk through this. But it is extremely confusing, just in the sense that, I mean, Commissioner Romano made some quite good claims there, retrospective to, we can't assist with delinquent taxes, in regards to what community action can do with those programs. And I'm just trying to understand how this is going to be different and why we're doing this in two different departments.
Sure, I'll try to add some background information, though limited. I actually believe the Financial Empowerment Center conversation has been going on for a couple years now. And it has been a joint effort with the Treasurer's Office and Community Action. So they have both had two personnel dedicated to that and working on that program. And it's finally gotten to the point where it came to its fruition, and they asked to meet, obviously, with the Treasurer's Office and then our office. And it was a joint decision, really, and through our office, that it be placed in MCA. We talked about having it under Health and Community Services. I don't want to speak exactly to it, but the treasurer didn't have a huge desire, and I believe even the recommendation wasn't for them to house the program. Part of why we're going the route that we're going and making a lot of the changes in the parent department of Health and Community Services is because these departments have a lot of overlap that you've pointed out today. MCA has veteran services. We have a whole nother veterans department. MSUE offers a whole host of services. Community Action does, Treasurer's Office. So some of these are very specific to who can apply, correct? And then they also have certain grant guidance. We felt because of the work, one, put in already by Personnel and Community Action, and we are going to reuse some of the Personnel and Community Action for the FEC going forward, that it was a really good fit. We talk about a lot of the wraparound programs and services. Again, a majority of those services are when you look at the people that would probably be most in need, are probably coming more in contact with community action. So it's more because they have those people that have the financial needs and concerns that aren't just tied to tax foreclosures. The FEC money can be used for other things other than just the foreclosures. So that's where you start to see the pulling in of the other assets and the other dollars that we can bring in and maybe partner with from community action. MSU UE has done a great job supporting the foreclosures already. Once we have approval for the FEC, they already have a whole plan from the federal level, plus also through the work done with treasurers and community action already. There's going to be a committee. They're going to end up pulling in many other departments. We've talked about in some ways for the financial coaching of having county employees in other departments maybe get that training as well, because some of the people that they're going to see that may come through their doors, they can provide a little bit of that knowledge base. There's going to be outreach with foundations. There's going to be outreach with other financial institutions and other community partners. So by no means are we favoring one over the other. We just felt that community action, with the whole host of other programs that they already offer, that was the best situated department and office to place it in.
Okay. I think this is probably one of the most challenging budgets that we're, oh, did you want to say something?
I don't mean to interrupt. I just wanted to add just a couple things, and I will apologize because I feel like I'm talking more about MSUE today than community action, but having, represented them for so long and seeing that financial literacy work that's gone on, a couple things come to mind which I just think are good information to know. So MSU did specifically have funds geared towards being able to pay things like back taxes to avoid that tax foreclosure, whereas our programs did not. So I misspoke earlier. But also within MSU for the last, I believe, 6 years, there's been one individual who has done all of those programs and carried hundreds of individual clients and done fantastic work, but it really has become a capacity issue. So it sounds like a duplication of services, but it really is an expansion of our capacity to serve people in this way.
What I was going to say in regards to this budget, I think it's very, very challenging just because, in the last few years, your revenues have decreased $20 million. This fund is obviously a special revenue fund that, is to diminish poverty. Obviously, what's happening today in our economy between inflation and all the other challenges makes it very, very difficult to operate this fund. There's no question about it. My only other question, I don't need the answer right now, but what I would really like to get is, based on the expenditures by service in your budget, what the county is paying for 100% out of general fund dollars. So these would not be grant fund related. They're specifically general fund dollar related that we're paying for. And the reason I ask that is because I see things on here. I may have or may not have asked this question last year, but I see Roseville repair, Sterling Heights repair. I don't even know what those are. Shame on me for not asking that question last year, but there's so many numbers in front of us. Every year we see something different, And I just want to get my head around as to what we're paying out of general fund dollars 100% for these expenditures specifically.
Yeah, I'd be happy to get that information.
Commissioner Van Sickle.
Thank you. You'll have to forgive me. I didn't understand in Vicki's elegant explanation of how this empowerment has been going on for a couple years. I didn't understand the need for the duplicating what MSU is doing.
So it's not
Should we take it out of their budget or
No,
take it out of
please
your
don't.
budget? But we don't need
Yeah.
two organizations doing the same thing, to Commissioner Sabatini's point.
Yeah, your point is well taken. I think in my purview, I don't see it as a duplication, but rather an expansion of our capacity to continue to serve more residents with services that are complementary but not the same.
It's clearly an expansion of your capabilities, but I still see it as a duplication. We'll have to talk offline and get some more information from the MSU people. Thank you. Thank you, Chair.
Thank you.
Okay, seeing no other speakers for Macomb Community Action. Thank you, Edward.
Thank you very much.
We are all set with that budget. We'll move on to MSU Extension, which is budget page C46. And Richard will be talking about that one.
Good evening. Can you hear me?
And he may be bringing up Edward, so Edward, don't leave.
Okay. Before we get started, my name is Richard Wooden. I'm the District Director for Michigan State University Extension for Wayne, Oakland, and Macomb counties temporarily. I primarily cover Detroit and Wayne County. Since Ed stepped out of the position in June, I've been asked to be the interim to cover Oakland and Macomb counties for MSU Extension. So before I get started, we will talk about that program, the Michigan Homeowner Assistance Fund, and I can give you some updated numbers on that program. That's the one that's designed to keep people in their homes. So we can talk about that briefly. Let me also just say this. As the interim, I probably won't be able to give you the kind of detail you need in terms of the specifics of how that program works, but we are willing to get that information to you. I have a nice brief summary on the program and the impacts and the dollars. So I'm just kind of giving you a heads up on that one. I've been in this
Richard,
role for
sorry to
about-
interrupt you, Richard. We are going to start with page C46 of the budget too, so anything specific to that, and then we'll go to the other pages in the special revenue, just so we're kind of keeping that order today.
Thank
So we have the questions, so they're specific to what you're talking about.
Okay. Before we get started, though, I do want to introduce Christy Evans. We've gone through a process of finding someone to replace Ed Scott. It was a tremendous loss to lose Ed. We went through an involved process, and we think we've got a great candidate. And the person that will be standing before you next year will not be me. Actually, it will be Christy Evans. And if the council, if the commission is willing, I'd like for her to make some very brief remarks before we get started.
Hi, I just want to say I'm excited to be here and learn. And my history is I've worked with MSU Extension for 10 years down in Wayne County, supervising the nutrition and physical activity programs down there. So food insecurity, those types of things are very close to my heart. And I look forward to meeting with more of you throughout the next year.
Okay, so yes, I have a copy of those numbers. Since we've talked a lot about the stuff we do with the financial and homeownership education, I do want to give you a brief overview. Carolyn, the administrative support person for this county, was very good in creating a document that really brought us all the way up to speed for that particular program. It's the Michigan Homeowner Assistance Fund. We've had since 2022, 239 households that have gone through that program. Of that total, 176 households received funding that will allow them to stay in their homes. And that total investment is about $1.3 million. So that has been a very successful program. I think there may be some issues with the funding of it. Talking to our support staff, they say those funds will run out in December. So they're trying to get all the new applications in before the funds go away for that particular program. So if you want additional information on that program, I'd be more than willing to get with staff and provide you with a more detailed report. But I did want to give you a summary of that one. I know there's been a lot of conversations about these programs. Also, in terms of the financial literacy in the programs that we offer, if you're trying to see a distinction between what we do in empowerment and the empowerment effort, empowerment financial literacy, even though we work with individuals, our focus is education. I think this same program came around, for those of you that remember me, I used to be the director of all 3 counties. And this was some time ago, and we had some conversations. We had some conversations about these same similar types of programs back then. And the difference was that for the empowerment zone effort, that was more of a deep dive in terms of working with people. What we realized is that for that specific population, those challenges were a lot more severe than the general person that we work with. And the goal was to provide a more intensive, ongoing type of relationship with those individuals. And at that time, there was even discussions about identifying potential funds that could be brought to the table if these people met certain benchmarks and criteria. That was beyond what we do. I appreciate the fact that you appreciate what we do, but we try to stay in that educational realm. We do some counseling, but not that deep dive. And those people have very severe issues that would require a lot of counseling beyond what we would do as an organization. So that's one of the big distinctions between the 2 programs. I do want to say this, you have a copy of the annual report for 2022. We had a solid year. I think we're on the rise. I think most of the extension services across the state was hit pretty hard with COVID. We lost staff like everybody else. We're in the process of rebuilding staff. In my opinion, I think our numbers are not where they can be, but they're headed in the right direction. So we feel pretty positive about that. We've been able to backfill positions. We're growing in the different categories and programs that we provide trainings and workshops and knowledge and information on. And I will say this, our 4-H number, that number is not completely accurate. We did have a glitch in our reporting system. So the real number is about 3,400 for youth in Macomb County. So we feel pretty good that that number is really higher than what was reported. We switched over to a new reporting system a couple of years ago, and we've just had some challenges in that process. But we continue to provide the programs. We continue to do it as a part of a cost share. The dollars that you provide, we leverage those dollars for federal funds through grants and allocations and through state funding. So this is not an organization where you're 100% funding extension. We share that cost, and we're proud to have shared that cost for so many years. And for some of you that are new, we've been around since 1914. So we've been around for a very long time, doing a lot of different things. So that's my overview. Do you have any questions about the budget? Hearing?
Okay, I had actually a question as well, but I don't see any other speakers. So Richard, your budget, you said you're having trouble with staffing. How many vacancies right now do you have with MSU Extension?
Well, right now, there's one vacant administrative support position that's county funded. We just lost our community development person, government public policy. That's a university funded position. So we're hoping the university will put the dollars back into that position to fund it. This is the person that helped administer the citizen planner classes, for those of you that are aware of that class. We've had a great relationship with the county. We have great participation in that class, and we're hoping that the university will reinvest in that position.
Okay. Don't see Commissioner Nard.
I have to be honest, I've not heard of this program, and I know of a lot of people that probably could have used it. I would like to see more education. I'm all for helping people and providing food and providing places for them to stay, but I would love to see that when we do these types of things, that we teach them to take care of themselves. So I'm really big on that. I'd like to know if you have something in your programming that does that,
Well, I mean, we offer a variety of programs. One of the favorite ones that I like, even though this one is targeted toward young people, we do a program called Adulting 101. And this teaches young people. And it also, we use this program to work with youth aging out of the foster care system. And the challenge was, what are all of those skills that you will need to be successful as you become an adult? It's funny, they call it adulting 101. We just call it growing up, but that's a different conversation. But what are all of those different skills that you will need to be successful? It's like, how do you manage your money? Okay. How do you have a diet? And how do you eat on a limited budget? And how do you do that in a healthy way? How do you deal with credit cards? How do you deal with your own emotional well-being? So there were a collection of activities that we provide individuals as a part of that process to address a lot of different issues. In terms of people becoming sustainable, the majority of our programs do focus on the financial part of it. How do you manage your resources? How do you manage your limited resources? How do you think about those payday loans that Ed referred to earlier as a part of that process? So we have individual programs, we can engage those populations. And also let me say this, since we saw the information that the commission provided that talked about how do we raise the visibility of extension. So one of the things that we've done is we've developed a list of programs, and our goal is to provide that list of programs to all of our stakeholders in the county. And what's cool about that, it'll be a running list every month. We've just piloted the first copy. Carolyn did an amazing job of putting that report together. But it's going to be a list of all the virtual programs and available face-to-face programs that people can take advantage of. And we're going to provide that information to all of the stakeholders. So if you have lists, or if you have newsletters, and you've got places you want to share that information, we're going to generate that information on an ongoing basis so you can share that information. And it covers everything, from food safety to mindfulness, to eating alone, to aging, all of those different types of topics. It even covers Tai Chi and well-being. So there are a lot of different topics that we're going to hit in that information. And we hope that when we get this process implemented, that you will share this information with all of your constituents, because this is an amazing program. When COVID hit, we had to switch to a virtual environment. And the challenge with that is that we lost some of the people that were technically challenged. But we gained a lot of people who were using those systems. So as we've gone back into the face-to-face programming, our goal is to get back to providing those face-to-face programming for those people that we missed, but also continue to expand the online stuff. So we got a huge offering we can provide people.
Does this provide a number so I can call? Because I know of students that are like 17 and 18, but they live on their own. They're still going to school. I make sure that they stay in school, but they don't have any parental guidance for whatever reason. And I just wouldn't want to lose those students. So I would like to know how I could connect them with something like this. I mean, it's ongoing. These kids take care of themselves, though they have apartments and all this kind of stuff. So
on the back of that annual report are all of our phone numbers for our staff. It's a little dated because it has a picture of Ed. So. Okay. And we have lost some staff, but you simply connect with our office and we can connect you with appropriate staff to work with.
Okay, thank you.
You're welcome.
Commissioner Van Sickle.
Thank you. Sounds like you have a lot of great programs. Little off the wall, do you have ad copy that you can supply to like community newsletters that they can just drop in to tell about your program?
If we don't, I don't think we do, but we can develop it. So, and that's what I'm excited about, because we saw the report that said, the commission said, you guys need to be more visible. People need to know what your programs are. So that's why we came up with the list. So if that's something we don't, I don't think we have it for the limited time I've been here.
Well, I'm thinking of a couple of newsletters that this would be great information to drop into, but I think you would do a better job describing what you do than the people doing the newsletters, if you will.
I will definitely work with Carolyn, and I'll work with Christy. So you can give her that charge so she can feel that piece. Because I agree that the more places we can put this information, the better off we are. You get a bigger bang for your buck for the dollars that you provide.
Thank you. Thank you, Chair.
Commissioner Wallace.
Thank you. Just really quick, I think you guys are doing a really good job. One of your employees, Crystal White, she does a really, really great job of letting the community know what she's doing, her classes, sends out invites. Like, she is great with the community and just keeping us aware of what's going on. So take note from her because she's doing really good. I saw it when I turned on the back. I was like, Crystal, I know her, but it's because she lets me know what's going on. But yeah, great. I think that, you know, just working with Ed in the past, just being able to reach out and brainstorm ideas of how we can help the community in our different districts has been really helpful. So I can't wait to do the same thing with Ed's replacement. So you will also be going on my list. So thank you.
Council, you're gonna love this. Crystal is now 100% in that role. So she will be able to do a better job as she, you know, increases out, what is it, social media presence.
Yeah, she's great. I love her. I love communication, marketing, what you're doing and all that stuff. And she's
Thank you.
Thank you, Commissioner. I just want to say one thing in regards to, Commissioner Nard had noted this in regards to high schoolers. I know the curriculum changed, and they've actually added a personal finance requirement now. One of my children took that last year, and I think it was great, quite honestly, getting our youth, you know, an understanding of personal finance, I think is huge. Just in regards to your annual report, what I don't need the answer now, would just be in regards to the residents that you did help through the financial ownership program. I would assume, you know, they're providing you some information in regards to, you know, if they own a home, if they're renting, you know, what they did, what their current situation was when they took the actual program. And then of that, the 121 that were facing foreclosure, if they're part of that 531 number, or if they're in addition to that, would be helpful. I don't see any other questions for page C46, so we'll move on here to D9, which is pretty straightforward in regards to grants. Commissioners, are there any questions related to page D9? Okay, seeing no questions for page D9, we'll move on to page D42. Primarily our moth suppression budget. Any questions on this budget page, Commissioners? Seeing none. Richard, I think you're all set. Thank you so much. Okay, next budget is Office of Senior Services. This is budget page D43 and 44. Sheila is here, waiting patiently.
Yes, very patient.
For quite some time, too.
Yeah, I have to get ready here, so.
You have the floor.
Thank you. Thank you so much. Okay, so I just kind of want to start with a little overview of the budget and some of the things that our office has been up to in the past year. First of all, we successfully completed our first year as an independent department. We were, as many of you know, were previously under MCA, and we launched off into our own department, and I'm happy to say I feel like we're on very solid ground since that transition took place. One correction on our budget pages is our mission is to promote aging well in Macomb County. I believe that the mission you have in front of you is for MCA. So this year in our budget, we have a rather modest ask of 2 positions, adding 2 positions, a part-time clerical and a part-time coordinator position. These positions will support the Elder Abuse Task Force and our phone management services in our department. In March this year, we launched a countywide Elder Abuse Task Force. This has been a huge project in our department and has required a lot of networking and engagement with departments throughout the county. We have the sheriff's department involved, we have the prosecuting attorney's office involved, we have adult protective services, we have several different financial institutions on board, community mental health is participating. So it's been a great undertaking. You should know that it's predicted that over 60% of elder abuse goes unreported. In Macomb County last year, there were 2,309 felonious assaults against seniors. That does not include scams, exploitation, or financial crimes. So it's a bigger problem than what most people think in Macomb County, and we're tackling it. So I am looking for some support, staff support to help us with that initiative. Our office receives about 2,500 calls a month. We have 3 staff people that filter those calls. That doesn't include outgoing calls. Our wait time to get through to our office can be up to 20 minutes for people waiting to get through. So the additional assistance for the part-time clerical staff is to help with that phone volume. Our seniors in Macomb County really depend on our office. So we really are the go-to place when there's issues or they have questions or they need some assistance. This year, the Office of Senior Services served over 500,000 hot, ready-to-eat meals. We installed 600 safety devices in our Safe at Home program. In our Handy Helpers program, we served over 800 seniors. We assisted 200 individuals with Medicare enrollment, and we added a new position last year of a case manager. Our case manager has assisted probably about 20 seniors who were on verge of eviction. Some of them, it was related to hoarding issues. She helped secure resources and helped keep them stable in their own home. We purchased 15 iPads for our adult day program, so they're going to be using a senior-specific dementia program on those iPads. And we added a grant manager position in January. Her position was added so that we could apply for a variety of grants to support our unfunded programs, like our Friendly Caller program. General fund dollars support meals and unfunded programs like our Elder Abuse Task Force, our Friendly Caller program, our case management services, and it supplements our meals, cost of meals. This year, we received some ARP funding, so we invested that funding in vehicles for our Handy Helper program and our Meals on Wheels program, and some other kitchen equipment. So with that, be happy to answer any questions from the board.
Commissioner Brown.
What's ADHS? What's that stand for?
Oh, Adult Day Home Services.
Okay, all right. See, it's going up over $100,000 for more than that. Over $100,000 for next year. What accounts for that? That just, it's the first year your department's, so maybe you under budget last year. Is that why you needed a?
Oh, those are additional resources. I'm sorry,
Yeah,
that's not the
additional
adult day
resource.
program.
So what additional resource, $100,000?
So every year, what happens is we get AAA1B, the Agency Area on Aging, will have additional funding to give us throughout the year. So they'll get to a position where they haven't spent all the dollars that have filtered down through the state. And so they'll award us additional funding. So that was probably nutritional funding, additional nutritional funding.
Okay. There's Kiwanis groups that I'm, in my district, my community, that has a surplus of things like beds and walkers and all the rest that are available for residents. Maybe you could take advantage of those things, so we don't have to buy them from Benson's. We could just
Right.
give them that, they reuse them.
Yeah,
Are you interested in talking to someone like that about?
Yeah, definitely. I became aware of that program about a year ago. We have a loan closet that we have similar equipment in.
There's probably more equipment available than need probably, because so many people had it, right?
Right, we have very small space to keep the equipment that we have, but we do refer to them when we don't have what the caller needs. So we do use them as a resource.
Okay. The congregate nutrition, that's, oh, yeah.
Yeah,
That's down in half compared to what it was for 2000,
Yeah, so
what's going on there?
our congregate dining really took a dive during COVID because we could not have, obviously, seniors dine together. So we're still working on bringing the numbers back up in that program. A lot of the sites closed and were not open, so
So last year, you didn't need the 1,000,003, you only needed about 600,000 roughly.
yeah, we're still rebuilding. There's a few locations that still have not opened up yet, so.
Okay. And your position count is the same as it was last year, I see. But didn't I hear you say you were looking for another position?
Yes, we are looking
Is
for 2 part-time positions.
Is that in a recommended budget that came from the executive's office? Or
Yeah,
is this something you're going rogue on?
Yeah.
I think
No.
there's a couple of things going on here, Commissioner Brown. Is the position count on D44 is incorrect. It actually, in the addendum in the position count in the back is the correct count. And I also believe there was a couple of positions that were eliminated to fund the ones that
Yes.
Sheila was referring to. So the numbers on D44 will need to, I don't know what the page is in the back. It's one of the addendums that have the position counts in the back of the budget. I'll get with Kyle on that.
Okay, all right. Thank you, Mr. Chairman. Thank you.
Hey, Steve, really quick, before you sit down, in regards to that specifically, your administration line, your expenditures by services has dropped.
I was just talking to Tanya about that, and I believe that has to do with how the budget is allocated and spread from all those other programs. And I think that's probably a gross number before we net out how it's spread. So I'm gonna reconcile that number too for you.
Okay.
Because you'll see it went from 2 million down to 822,000.
Yeah, but your personnel
So
line item went up.
the admin to me is Sheila and the office staff and that sort of thing. So the total is okay. I think you'll see on D43, there's a transfer in and a transfer out of 1.5 million. So that's,
See, the administration is not the personnel line item?
no, the personnel item includes administration plus folks that we have charged out to all these other programs you see in the services, all the grants.
Commissioner Zinner.
Oh, sorry. In regard to the elder abuse task force, can someone call them by themselves or, personally, or do they have to go through you, through your department?
Well, that's one of the things we're looking at. The current process is they would call Adult Protective Services. And that referral would be investigated by either law enforcement or Adult Protective Services. We're looking at some options of having a hotline available to the public to call. And the state just came out with an online reporting form that anybody can go online and if it's related to financial abuse and fill out and submit at the state level. So
that's for financial.
yes,
What if they thought but they had another concern?
it will go through Adult Protective Services. They have a central intake that's housed in Grand Rapids. Unfortunately, the statistics show that only about 10% of those calls get opened and investigated for whatever reason.
Someone in the prosecutor's office had suggested to me that, that people should, depending on the situation, call this task force unless it's a severe situation, because many things should go to the task force versus necessarily the police.
Yeah, well, eventually, we're looking at that whole system and the process flow related to that system, so that it's possible that at some point we'll get there. We just have not set that up yet.
Right.
But
Okay, thank you very much. Thank you, Chair.
you're welcome.
Commissioner Perna?
Just to add on to Commissioner Brown's comment about excess inventory for crutches and beds and so on, most fire departments have that. If you live in Clinton Township or Warren, you go to the fire department, you show your ID, and they'll give you crutches or a wheelchair or a bed, and when you no longer need it, you return it. You don't, it's free.
Right, right.
So I don't know,
Yeah,
if
that's-
commissioners know that, your fire departments probably all have that.
Commissioner Kraft?
Thank you, Mr. Chair. Commissioner Perna is going to have a scooter available in the next couple weeks for you too. So if you want to
I'll
jump
have
in
it
line now.
delivered.
I didn't use that long.
Sheila, great job since taking over from the split. Everything seems to be going really well. I know you are very active and your team is very active in helping our seniors. My question / comment is for Steve. The position schedule in the back matches the personnel number that is here. So I don't know what the correct number is. It supposed to be 47.74? Because both of those numbers are
The
the
correct
same.
number is 51.56 and 49.65. I will work with Kyle to get
Thank you, Steve.
amended pages.
Thank you. Thank you, Sheila. Thank you, Mr. Chair.
Just blame it on workday.
There you go.
It's everyone's excuse this year.
Sorry, Mr.
Commissioner
Chair.
Zinner?
You don't have COVID to blame anymore.
Maybe I missed this. Do you think you need another person for the phones?
That's what we're asking for, yeah.
Okay, thank you. I'm sorry, I missed it. I figured you must need it.
Yeah.
Since you're 20 minutes on hold.
Seeing no other questions, Sheila, I think we're done. We're done.
Thank you.
Thank you for
Thanks.
being patient with us here today.
Thanks for telling me though.
Okay, Commissioners, I think we are through all of our budget reviews for the day. Next item on the agenda is public participation. This is the second opportunity for public participation for the public to speak for a maximum of 3 minutes on any issue. Anyone from the public like to speak? Going once, twice. We'll close public participation. Next item is commissioner comments.
Chair, did we vote on the last item?
No, we need to vote.
Oh, we do need to vote. It was a 2-hour-plus item, so we do need to vote. Please vote. Yeah, there was a motion just to receive and file.
Motion passes 10-0.
Thank you, Commissioner. Commissioner comments. Let's see here. Screen is loading. Still loading. I don't see any speakers. Oh, we do. Okay. Commissioner Nard?
Yeah, I just wanted, the things that I passed out, I was at a meeting with SimCog at the Detroit Athletic Club this afternoon for the Six Rivers Land Conservancy. And they wanted me to pass those out just to let people know that they are out there trying to, let me just read what they gave me. Six Rivers Land Conservancy is a private nonprofit land conservation organization working to sustain the quality and the character of the natural resources around us. They recognize and understand the value of an inviting landscape and a strong and vibrant natural resource base in our communities. It makes the vital and healthy places to live and attracts people with institutions. Attracts people, and I don't have my glasses on, y'all. Attracts people and institutions that create prosperity. Six Rivers is supported through grants, donations, and sponsorships. And they just wanted you guys to know what they were doing. And I'm even looking into calling them to do some things in Warren to help preserve, because we've been cutting down trees there for whatever reason. And then we just need to replace that and keep in mind to take care of our landscapes and infrastructures. Thank you.
Commissioner Brown?
Yeah, thank you. I want to remind everyone, tomorrow we got a 1 o'clock meeting here. Fun starts early tomorrow. It's a double header. So you're welcome to come in at 1 o'clock. And more importantly, Friday at 11 o'clock downstairs in the lobby, we got our send off for Vicki. And so if any of you want to come by and share in the festivities and swap stories and.
Who's catering lunch tomorrow?
It's on your own. This is it.
Okay.
I just came from Holland. I'm getting more Dutch and Dutch all the time. Thank you.
I nominate Van Sickle to be our grill master.
Wait, there you go. He's a
There you
good
go.
grill master for sure. Thank you, Mr. Chairman.
Thank you, Mike.
Any other comments,
Appreciate
Commissioners? Seeing none.
Motion adjourned.
Made by Kraft, supported by Wallace. Please vote. See everyone tomorrow at 1.